Hi, welcome to Detours, Understanding Acquired Brain Injury. I want to welcome Colleen, who is host for us. She's been here before, but we're trying to do this way so that we can present the areas she's interested in. Colleen will be talking about sepsis, post-sepsis syndrome, and about encephalitis and other non-traumatic types of brain injury related to infections and exposure to toxins and other things in the environment which cause neuroinflammation and other problems. As you know from the video that is posted about these disorders, they cause the same kind of neurodestructive cascade that you see in traumatic brain injury. Also, Colleen has a history of traumatic brain injury, as many people do who have acquired brain injury. They usually have others as well. So Colleen,
Hi.
Hi.
I'm Colleen. I got sepsis in 2017. Sepsis and encephalitis. It caused a lot of problems. I'm still, like 5 years on, I'm still struggling. What else would you like to know?
Well, I mean, if you could start with, like, first of all, your history before you had sepsis. If you could tell us, like.
Sorry. Yeah, sure. Before I got ill, I had a few symptoms. They felt like a flu, to be honest. Little achy pains, not feeling quite right. Couldn't quite put my finger on it. I just thought it was run down. Didn't really think about it. Didn't see a doctor about it. Didn't bother with it. A couple of weeks later, I started to have hallucinations, and I ended up going to the hospital via an ambulance. They told me it was lack of sleep, and they sent me home with some sleeping tablets. Probably a month or so later, 6 weeks later, in fact, it was. I started having more hallucinations. My behavior had altered completely. My partner realized that something was seriously wrong and took me up to the hospital. I actually walked out, drove myself home like an idiot. And my husband had to bring me back the next day. I was diagnosed with having sepsis and encephalitis. I was in hospital for 3 days. I don't remember much of it. I remember having delusions in the hospital. I remember seeing my husband change before my very eyes. That was terrifying. It was scary, and I reacted differently per delusion. I had about 3 different ones that it switched to, and I reacted really badly. I was trying to run away, pushing him away, shouting at him. Did really well to hold it together. But yeah, I don't remember anything else until I woke up with a security guard next to the bed. I couldn't understand why nobody told me why. That was also very frightening. They did say I needed some more tests, and I remember having spinal tap done. I woke up a couple of days later. They said that I had sepsis and encephalitis and go home. So I did. And at first I thought I was just tired and it would take time, and I had been really ill. But yeah, 5 years on, I'm not much better.
And a lot of what you describe, as in my video about the effects of sepsis in general, I mean, sepsis specifically is typical. The hallucinations, very common. The confusion, the aggression, all of these things are typical with inflammation of the brain, affecting the occipital lobe, and perceptual disorders, very common. Again, described in the video. The specific hallucinations, like the visual types and the distortions, I mean, these are illusions as well as the hallucinations, and the delusions and the paranoia and the fear, again, very common with sepsis. And many people with traumatic brain injury, we have a 12 times greater risk within 5 years of traumatic brain injury of coming down with sepsis. The encephalitis, there are a lot of different reasons that we do, or higher risk for catching and for Septic encephalitis are all different kinds. They can come from ordinary infections, from upper respiratory infections, UTIs, all kinds of things, skin infections, as well as some of the more exotic zoonoses where you can get it from mosquito bites and things like that. They're less common, especially in the UK where you're from, as opposed to here in the States where, it's like, especially in the swampy areas on the East Coast, where you see a lot of these kind of infections. The Eastern equine encephalitis, very rare, but very destructive. Western St. Louis encephalitis, things like that. But most common you'll see either from the herpes viruses, very common. And I'm not talking about the STD here. I'm talking about like cold sores, and about 90% of the population of humans has this variant. And but what makes it flip over and become the kind that affects the brain has to do with immune factors and extreme stress, as well as the early days of after traumatic brain injury within the first couple of years, things like that, the blood-brain barrier effects on the blood-brain barrier, things like that. It depends again, it's a variable related to the individual and immune signaling and all that kind of stuff, which no, we're not going to get into that, but I just wanted to touch on that. Now, could you tell about your history, as far as with seizures and as far as like your head injury and stuff like that?
When I was about 13, I started having absences. I think my mum said I would stare off into the distance with it. Could be a couple of minutes, a couple of seconds, but I wasn't aware I was doing it. My personality also changed, and so did my behavior at school. I started walking out of class and things like that. My grades went down. A couple of months later, I collapsed. I don't know. They estimate I was there for about 2 hours because my body temperature was so low that I thought I was going to have hypothermia. But yeah, they think I probably hit my head at that point. They said that after a long sort of like a session of testing, it was some sort of hormonal epilepsy, and it will affect me, when my hormone levels rise. So puberty, pregnancies, menopause, things like that. Apparently can have it throughout their periods, but that never seemed to affect me during my periods, only when I was pregnant and when I was in puberty. They gave me Epilim, that calmed everything right down. I didn't have no more instant seizures. I was more like collapsing. It wasn't like a shaking fit. I think they're called atopic. Is that right?
There are many different kinds of seizures. There are like many kinds of seizures. The absence seizures you described, the staring fits, and like I had after I was hurt the first time, I had what you call absence seizures, which are the staring spells, and some automatisms, which would be like where you do automatic behaviors without thinking because there's no awareness. You may get up, wander around, walk out with not being consciously aware at all. There are other behaviors like you may like pick up a ball and just bounce it, and it's like any of those kind of automatic type of behaviors. Some people have driven completely unaware. There are different reports of those kind of behaviors. There are seizures that only happen when you're asleep, the Rolandic types. There are post-traumatic seizures, post-traumatic seizure disorder. I have that. Several of our hosts do. And it's like it's common with brain injury, but it can also happen due to other factors. High heritability, genetic factors play a role in the development of seizures. If you don't have, those without brain injury, obviously without traumatic brain injury, but due to acquired factors, lack of oxygen in utero can cause that, causing scarring on either the hippocampus or the frontal lobe, which are the most common locations, but there is such a thing as temporal lobe seizures, which cause a lot of behavioral manifestations, non-convulsive seizures, which are purely behavioral, or causing people to see things, hear things, taste things. It can even affect their thinking, like they'll have like intensive thoughts and delusions, which if you put them on an EEG, you would find the characteristic epileptic waveforms, triphasic kind of waveforms, things like that. Again, not getting into that here, but I just want to address that it is things that can happen and things you would not. I mean, everyone pictures, fall to the floor, shake. Oh, that is just one type, and that is generalized seizures, partial to generalized. But there are many other. They're called many other things. Some of the older terms, like a fit or whatever else. But there are many different ways they manifest, and they can lead to traumatic brain injury, not the seizure itself, but the effects. If you fall to the floor and whack your head, they definitely can give you more concussions and traumatic brain injury. Or if you can't breathe, there are some seizures where they become so severe that you go into what's called status, and you can't relax your muscles, and so you don't get oxygen. When you hear about people dying from seizures, usually this is the reason why. They cannot relax their muscles and they suffocate to death. So yeah, definitely not serious. And so you also suffer traumatic brain injury and hormonal signaling in women. Yes, there are specific seizures that women get when they are throughout their monthly cycle. So yes, definitely a factor. And I do want to talk about seizures at some point, in the future, because they definitely affect those of us with traumatic brain injury. We are many times more likely to develop seizures as a result of not only traumatic brain injury, but many people who end up with brain injury have a history of seizures. The connections, fairly clear. Okay, so you had your head injury and your seizure disorder as a result of, like genetic factors for you. You take medication to control them. Do you still take meds to control?
No, I was quite lucky. I only needed to take it for about 6 months. A low dose. Throughout my pregnancy, they gave me a low dose, which kept me seizure free. And I've been cleared of having epilepsy, although they have told me I might need, epilim again when I hit menopause.
Okay.
But otherwise, I've not had a fit since my last pregnancy 10 years ago.
Okay. All right. So what symptoms do you find you have today from your sepsis encephalitis currently, that 5 years later?
The list is long. Well, I think the biggest problem for me is lack of sleep. I don't fall asleep. If I do, it's an hour here, an hour there. I can't seem to just switch off at all. I never I can't explain it. I'm tired, but I can't fall asleep. That drives me mental. But I sleep about 2 hours a night, and then maybe I'll get an hour in the day or a couple of hours if I'm absolutely exhausted. Otherwise, I don't have a proper sleep pattern at all. The other one is I can't shut out background noise, and it drives me potty, and I'm not even kidding. It drives me mental. I've got 2 children who obviously have friends that come around. They've got different consoles playing. I can hear each one in each room. It drives me nuts. And after a while, there's a point where I sort of have an emotional breakdown, I guess. And it can come across as very aggressive. It can also come across as me crying. It depends on the kind of day I've had, I think.
Right. And this is something to keep in mind for people with, either whether it's acquired and non-physically traumatic, or whether it is due to whatever. It's like many of us have trouble with what's called sensory overload, and that is whether it is light, whether it is sound, whatever it may be, or even smells and touch. Or we don't, because of frontal lobe issues, we do not filter sensory input like we used to be able to do. And so like too much bright light, flashing lights, any of those kind of things could cause problems, but so can too much sound, whether it is too many people talking at once or making noise at once, or whether it is certain sounds that can, sirens or screaming or whatever. And she also mentioned another symptom she has, which is emotional lability, which is quick changing, which is like being angry or crying or whatever. And these can be signs of either overload, or they could just be problems with emotional regulation, another frontal lobe symptom, typically right frontal lobe, but Now you can see that from. And also irritability and aggression are very common. They're like one of the most common emotional and affective symptoms that you see, regardless of whether it's traumatic or affective. Um, and that is the one that usually gets most of us into trouble, because it doesn't take much to provoke anger or aggression for us. We don't, that relates to the impulsiveness and the problems filtering. If you have a problem as problems filtering out, stimulation, you usually have a person who has a problem with anger and aggression, because they're kind of linked together. The two are kind of seen together. And so medication can help with that, can help, especially with the irritability and aggression, as well as behavioral techniques. See my video on irritability, aggression, those kind of things, to help with that, because you hit your kids, you hit a spouse, you hit a stranger over nothing. It's a quick way to land in jail. So treatment for this, beta blockers is good, SSRIs are good, very good for that, as well as like a behavioral program to help keep you out. 85% of the ladies in jail have brain injury.
Wow.
Here in the States, and the numbers in the UK are kind of similar. And over 50% of men who are in jail for aggressive, or, for violent crime have brain injury from childhood abuse, physical abuse, and abuse by partners and stuff. Just as a quick note, that does link to something I'm doing with a friend of mine in a few days on DV, domestic violence, and brain injury, just as a side note. All right, so now, what about any cognitive symptoms you may have or affective symptoms?
I I've noticed loads of changes with personality, with the way that making a brew is like simple things. I can't do them anymore. I hate it so much. Uh, I try. I've come to the conclusion.
Okay, so hopefully, we had a little bit of like a breakup, so hopefully this will get this to continue. Sorry about that. Signal between two countries. So anyway, so you were saying you had trouble making broom, putting broom together, like,
Making tea, I would shake continuously, and that would make me spill my brew and end up with it scalding myself a lot of times.
do you still have tremor? Do you still have tremors?
Yes, daily.
Hmm.
Another thing is just not lift things as I used to. A lot of it is my weight, I think, to do with that as well, because I lost so much weight.
Hmm.
With it, when I got sepsis, I just lost. I think I went 3 dress sizes down. I mean, it was ridiculous.
Wow.
Yeah. Uh, so I can't lift things like a pan of water, or putting a casserole dish in the oven. I have to get my husband to do those things because I can't physically do them. It frustrates me, and it does make me feel a bit like a burden on the family, because I feel like other people are picking up after me all the time.
Yeah.
Although my partner tells me continuously I'm not a burden, I do feel like it.
A lot of us do, and that's important to hear from family that you're not, because it's like we contribute in other ways, but it's just like sometimes we feel that way and emotionally, and since we're a lot more like a lot of us feel guilty and we feel like we don't quite measure up, and that's important to hear from family and loved ones out there. It's like, please tell your survivor that you're the person you're helping out. Tell them, let them know, because even if they don't say it, many of us feel it. Many of us either can't voice it properly or don't want to admit it because we're afraid we'll hear from you. Oh yeah, you're a total burp. Please, please, like, let us know. It's like, or if we're missing the message or if we're missing something, communicate with us. We're not psychic. Okay, please, but do communicate that with us. It's important. Um, so like I'm assuming memory issues like all of us have, fatigue.
Yeah. Memory fatigue. My taste has changed. I like spicy food now. I used to hate it.
Yes.
Um, I don't feel hunger. That's a really big one. I do not feel hunger. I used to be able to say, "Oh, that's like that smells gorgeous. I'm starving."
Mm,
I've not done that in 5 years. I'll say that smells nice, but it doesn't inspire me to eat it. And food
mm,
tastes different. But yeah, I don't know. I just don't ever feel hungry. My partner has to literally put food in front of me because I forget to eat, you know.
That is typical. Also, that's a frontal lobe thing. The drives are affected many times. Food, sex, and all those kind of drives are typically affected by frontal lobe damage from either traumatic or from acquired brain injury, sepsis, all that stuff. Any of those can affect drives too.
Yeah,
If it's weird, if it's something weird, it's usually a frontal lobe thing,
yeah.
unfortunately. Um,
Well, like I say, personality definitely changed. Memory is horrific.
so
I,
how has that changed?
my personality,
Yes.
I haven't got the tolerance that I used to have for things. Um, I used to do psychology and counseling. I don't
Mm,
do that anymore. It would exhaust me. I couldn't physically do it, even if I wanted
mm,
to. I can't physically work now because I'm so exhausted during the day and I
mm,
haven't got the ability to concentrate, let alone, actually do a job. And I'm nodding off sometimes halfway through the day because I'm worn out.
mm,
I, I can't physically work because of those things, which also adds another stress. It adds financial pressures to the family. It also adds, it would drive. I had to start doing something with myself. I started making things because I would go nuts if I didn't.
mm,
Because I just honestly, I feel like a complete waste of space.
mm,
I can't contribute to the household income, and my partner's doing a lot of the things that I should be. So yeah, at least by me making things, I feel like I'm actually giving back somehow.
mm.
You know, I sell my little bit. People like them. But
And it's like I do want to thank you. You help this way too. You're contributing to helping other people understand. And by sharing these kind of videos, and this is why I do this. I do work sometimes, but I can't work like I used to.
yeah,
Stacy, my wife, contributes more. You know, I'm a nurse and all that. It's like I don't have the stamina. Lots of us don't have the stamina and strength, and that's a side effect. And I have a video that I talk about neurofatigue. It has to do with how our brains have to rewire. They're not as efficient electrochemically as they used to be because they have to transfer energy over a longer distance. Just like a long wire becomes less efficient. This has to do with why you have the fatigue, and there are other reasons too, inflammatory factors and things like that. It's complicated, but this is why after an acquired brain injury, whether it's sepsis, infection, whatever, why that's a factor too. But it's important to know as a survivor, you're not a waste of space. You're not a waste. And it's like one of the ways you can do is to help others, voluntary, and just
yeah,
and for family members, remind your loved ones that they're important to you, and it's the support they provide emotionally is valuable also. So like I'm assuming then a lot of executive skills has been affected for you, like planning, sequencing, the big picture, understanding those kind of things have been affected.
yeah. My planning skills are pretty useless. I really have to plan, and if I do, yeah, my husband in the background going non-existent. So I'll be honest, they are useless. Um, Financial stuff like paying bills, things like that. I forget to do them. I was getting in debt because of it. I've literally asked my husband to take over all financial issues
Mm,
because I was concerned that we the rent wouldn't get paid or something.
right.
So he does all that. That's just another one more thing on his shoulders.
Mm,
Um, if I do go out, I have to truly plan it. If I'm on my own, it's only a short journey. I get anxious when I go out. I can't explain why I'm so anxious, but I don't like going out on my own. I have to have somebody I trust with me,
mm.
dog or the other.
That is also typical. People with acquired brain injury, whether it's traumatic or non-traumatic, we are 8 times more likely after our injuries to be depressed and 6 times more likely to have anxiety. It also has to do with those frontal lobe skills, because it takes a lot of effort and planning, and because we can't always anticipate as well as we used to, because we have trouble understanding the mind and behaviors of others. We're not as efficient at that as we used to be. It leads to increases in anxiety because I can't necessarily plan as well because I don't quite understand what somebody else might do. I'm more likely to be anxious. I'm also not as cognitively flexible as I used to be. So I like things to be routine. I need them to be this way because surprises unsettle and make me more irritable. That is why. And cognitive retraining, cognitive therapy can help. And there are some medications that can help. Things do get better over. The thing is, you recover for the rest of your life. It's not 2 years and you're done. This is for the rest of your life. It's just that instead of it being fast, it's much slower over time. That's the difference. But yes, these are why, and there are whys. It's just like, darn it. Yeah.
Yeah, memory's also a big issue. Like because I can't remember things, and
Yep.
forget things, people's names, that gets me into trouble. I feel when I forget.
Yes, as my wife would tell me, it's a miracle I remember my own. But I was never great at names anyway.
Yeah, yeah.
Mm.
I was quite upset a couple of weeks back because my kids had mentioned a memory that I couldn't remember, and everyone else seemed to remember this memory, but not me. And I actually started to feel like, well, did it even happen? And I felt excluded from my family, which was really weird. And it took a little bit of time to get around that, on a psychological level, anyway.
Yeah, and for a lot of us, again, like it's memory, irritability, fatigue. Those are the big ones for us. Those are the major sources of problems. And there are things that can be done for all of these. And I do have like mentions below. And as we talk more with other episodes, I'm going to ask you to share if you'd be willing. And I have and other hosts have shared two things that help them. Um,
Definitely. I have
and
quite a few.
the stuff that doctors recommend are really, for past 150 years are the things that work best. Getting sleep as you're able. And if you have trouble with that, it's like sleep docs and things like that have some that help and some that don't. Some people just will always have some trouble with sleeping. That is one of those side effects. Diet. Even if you don't feel hungry, things like that, making sure what you do put in your mouth is not processed, not stuff that invokes inflammation, because inflammation is one of those enemies. One of those things that's ongoing, even if you don't have an infection at the time. Jumping on top of sicknesses as soon as you start to feel symptoms, very important. Exercise. And don't not like going crazy at the gym, but like walking, swimming, just generally low impact, but more duration, that kind of stuff. Those kind of things help best, at least for the foundation. Then taking good care of your mental health, making sure you take a break for yourself, drawing boundaries for yourself. Like, don't go out if you feel tired, stuff like that. And then the cognitive rehab, like trying family game night, trying things where you have to work on cooperation, controlling your frustrations, like those kind of things. Because practice, practice, practice. That really is what cognitive therapy boils down to, is trying things even if you fail. In fact, failing is good because it teaches you, again, those social kind of skills. I mean, that's really what's at the heart of the best, you know? All right. So I just really want to thank you a lot. I appreciate you sharing all this. I did want to introduce you and at least get people familiar with you because they'll be seeing you, for other episodes, and you'll have your own space. You can talk about sepsis, TBI, whatever, and how, encephalitis and how it helps, what you've done to help yourself get better and how you can maybe help other viewers. And, I want to thank you and thank everybody else in your family for being patient while I took up some of your time. But, it's like, I think you'll help a lot of people. And so
Thank you for talking to you.
thank you so much. And I appreciate it. And everybody watching, I just want to say, it's like we have, Colleen as a new host, but we've got others too who do different things, like talk about family matters and him brain injury, and we have like minor traumatic brain injury concussions. We have another one who does, we have Kate who does exercise and athletics and stuff like that. We have me who does mostly the medical kind of stuff as well as general. We'll be having somebody join us who will do aneurysms and strokes. And so and then we'll have somebody joining us soon who will be doing domestic violence, traumatic brain injury, and like generalized stuff like that. So just want to say thank you very much, and please click like and subscribe. And if you have any comments or anything you want to add or questions for Colleen, please put them in the comments below. And thank you very much, and have a good day. Bye.
You too. Speak to you soon. Bye-bye.
Bye.